Well, a lot of guys have signs of low testosterone, but they might brush it off as just kind of part of that aging process.
Or they may just ignore it because they're too embarrassed to talk about it. A good time to change that Wednesday at a free men's health forum.
Yeah, it'll feature Nebraska Medicine physicians. Dr. Christopher Dybert joins us alongside nurse practitioner Anna McGrain. Thanks for stopping by this morning.
Thank you.
You know, we hear guys complaining, maybe tired, whatever it is. And some don't really take action on it. But describe this event, because you're going to have an open dialogue and discussion. What should men expect?
So Nebraska Medicine, we find it's our really duty and obligation here to the greater Omaha community to serve everybody. But for this event, it's really focusing on guys, as you mentioned. And we want them to come and hear from myself, from some of our experts in urology, about some of these very male-specific medical problems and help them understand that some of these signs and symptoms may be testosterone related, but it really may be a symptom of something deeper and something else related to their medical health.
Yeah, it's going to be a candid discussion. I mean, everything's on the table. Describe some of the topics you're going to be addressing.
We're going to be talking about erectile dysfunction. We're going to spend some time talking about testosterone deficiency and some of the signs and symptoms and risks related to that. We're also going to be talking about diabetes, another large medical problem that affects a lot of people in this community. And then we're going to spend some time doing screening as well. Some depression screening, erectile dysfunction screening, as well as looking just at a basic of blood pressure for men as well.
And it's important for men, for everybody, but men in particular seem to not ask as many questions. Would that be a fair statement? I mean, I hear that from
Nikki, you're right, yeah.
friends and sisters-in-law and everybody that, you know, you need to be out there asking questions, kind of advocating for your own health.
Yeah, that's right.
So basically, like, we're trying to give men an opportunity to come to an event catered to them for that reason, that, you know, this isn't making, you know, an uncomfortable place for them to be able to hear presentations from board-certified physicians, and Dr. Dybert is fellowship trained in men's health specifically. So an opportunity to talk with the experts.
Why is it important for these discussions to occur? When you're talking ED or you're talking low T, why is it important for these guys out there not to just, you know, push those issues aside, but to get out there and talk about them?
So none of these issues happen in isolation. It's not just an erection problem. It's not just symptoms of low testosterone. These could be early manifestations of diabetes, more extensive heart disease or high blood pressure, and sleep apnea, depression. There are a lot of different reasons that can be related to these specific problems. Erectile dysfunction in particular is usually an early indication of more significant heart disease.
Yeah, and we're taking a look at this graphic right here, the causes of erectile dysfunction. You want to break that down for us?
Sure. So the big segment there, the vascular segment, is what I'm talking about relating to heart disease. And oftentimes erectile dysfunction will present a few years prior to the onset of more significant heart disease risk, like high blood pressure, even something as serious as a heart attack or a stroke. Diabetes is the other big segment on there, because both heart disease and diabetes can cause problems in the very small vessels of our body. Those that are responsible for erection, those that are also responsible for our heart and kidney function.
But I see 15% there of the pie is attributed to medication.
That's right. A number of the medications that men may already take for other important medical reasons may have side effects that can cause a change in their erectile function. And so when we meet with men, we look through all those medications, we try and figure out if there are other underlying causes, and then if we can make small alterations into either their medications or diagnose and treat some of these other medical conditions, we can often improve their erectile function.
And I would imagine, like any other disease, early intervention is certainly the way to go to prevent the actual onset and also to minimize any severe symptoms.
Right, and we can offer that to patients. So if we find that they have vascular issues, they have other medical conditions that need to be addressed to help their symptoms, help their quality of life, we can connect them with experts at Nebraska Medicine.
So it seems like the ads are a little bit misleading, because you see all these ads, it's like, if you have this, take this, and you're saying
it's not just
if you have this,
treatment.
You may have some other things going on that you need to investigate, which is great information.
Yeah, and we hear a lot about this, and it's almost like low testosterone has almost become kind of like a joke amongst guys out there. You like, if somebody's, well, I'm tired today, well, you must have low T. But there are, like you said, there are signs and symptoms, but why is this such a hot topic right now when you're talking about low testosterone?
Well, it just as women's health was probably 15 years ago, the estrogen, and it's kind of come full circle, and now we're talking about men. And you know, everybody wants those, the best quality of life, the vitality, you know, and we can offer that. We can also then help make sure we're treating a patient as a whole person, though, and offering treatment for other conditions as well.
Yeah, here's the website we're taking a look at. But doctor, can you go over real quickly? I know we've only got about 30 seconds left, but some of the signs and symptoms of low T.
Sure, you mentioned one. I mean, low energy, low fatigue, depressed mood, extreme irritability, some sexual side effects as well, or sexual dysfunction. But the real key is that is just one possible spectrum of symptoms for testosterone. It may be a whole host of other things, and really getting to the bottom of that is what we want to do at this event, and as well as when we see men in our clinics and in our offices.
Nebraska Medicine, you're always doing a lot of stuff. I went to the website. There's lots of articles, blogs on this subject, but Wednesday, it's a great time to get down there and actually talk to some of the professionals, such as yourself, because it is free, but you do need to register. So call 922-0000, or you go to nebraskamed.com/men. Get all the information. Like I said, it is free, but you do need to register. You want to know how many people are coming?
Yes.
Yeah. So thanks for your time this morning.
Of course. Thank you for having us.
Conversation. Guest of the Morning Blend starts